Hi, and welcome to Crack the Nac. This is a multiple-part video series that will prepare candidates for the Nac Osce. What is the Nac? The National Assessment Collaboration is an objective, structured clinical exam that is designed to evaluate international medical graduates for readiness for residency in Canada. The exam was designed to assess international medical graduates, IMGs, to see how they fare against their Canadian counterparts. The material on the exam is what would be expected of a fourth-year Canadian medical student preparing to enter residency. Prior to enrolling to take the Nac Osce, a successful candidate must have completed the Medical Council of Canada Evaluating Exam, the MCCEE, and this exam must be passed. The Nac Osce occurs twice a year in September and March. Exam spaces fill up quickly across the country. It is important that you proceed to the Medical Council of Canada website and enroll in the mailing list to be notified when exam spaces are available in your area. The cost of the exam is $2,230. This does not include transportation or accommodation, but may include meals on the day of the exam. The Osce itself is 3 hours of testing. Total on-site exam time is 7 hours, including check-in, orientation, examination, and a sequestration period, which is following the exam. The Osce itself is comprised of 12 stations, and each station is 11 minutes. Topics include medicine and subspecialties, including cardiology, respiratory medicine, as well as gastrointestinal, surgery, pediatric and adolescent medicine. It is important to note that due to the difficulty of standardizing a pediatric actor, it is unlikely that you will see infants, toddlers, or pediatric population below the age of 8. You are more likely to see adolescents and teenagers or caretakers of pediatric population, but you will not be seeing infants, toddlers, or children. Psychiatry is a common topic on the Nac Osce, and it is important to be well versed in common psychiatric conditions of all age groups. Obstetrics and gynecology is also a common subject on the exam. Preventative medicine and community health, topics like vaccinations, sexual reproduction, communicable diseases are all fair game for Osce stations. On the day of the exam, it is important to eat well, as you'll be on site for 7 hours and may not have access to food prior to the exam. It is extremely important that you dress professionally, well-kept shoes, comfortable, well-fitting clothing that you can perform physical exams as well as be comfortable sitting or standing throughout the day. It is important to look the part of a future physician. Items that you are required to bring for the Nac Osce are a stethoscope, a reflex hammer, a white lab coat that is unmarked in any way. No logos, no names, no school crests. Bring identification and nothing else. If you are required to bring a cell phone or a wallet so you can pay for transportation or contact a friend to pick you up, that is acceptable, but the less items that you bring to site with you, the better. There are 2 options for station duration: 8-minute station with a 3-minute question, or an 11-minute station with no questions. Outside of each station, there will be a case presented on the wall or door, and the case will also be within the room. In the instructions of each case, you'll be asked to perform a task. Conduct a focused physical exam, a focused history, address patient concerns, or conduct a focused history and physical exam. For example, the instructions could read, John McDonald presents to clinic with 3 days of abdominal discomfort. In the following 8 minutes, please perform a focused physical exam. There will be an examiner question at the 8-minute mark. Mary Smith presents to clinic with 6-month history of feeling blue after the loss of her husband. In the following 11 minutes, please perform a focused history. Do not perform a mental status exam. You may be asked to address patient concerns. Joseph Montgomery presents to clinic with concerns of familial history of cancer. In the following 8 minutes, please address Joseph's concerns. Or you may be asked to perform a history and physical exam. Michael Smith presents to clinic after falling during a soccer match earlier today. He is complaining of knee pain. Please perform a focused history and physical exam. You'll be given a candidate booklet when you register. In the booklet, you will have barcodes that represent your individual performance on the exam. In each station, you're required to hand your barcode to the examiner. To make this as seamless as possible, when in the hallway reading the instructions, prepare the barcode and attach it to one of your fingers. So as you enter, you can seamlessly hand the barcode to the examiner. Once this is done, it's important to pretend the examiner is not there. From time to time, the examiner may or may not write things down. Whether they're writing or not writing is not a predictor of your performance in that station. To the best of your ability and for your benefit on the exam, it's important to ignore the examiner and pretend they are not in the room. The standardized patient, however, should be treated as a real patient. They have positive physical findings. They have excellent histories. These cases are fully developed by a team at the Medical Council of Canada and are extensive in scope. Once you greet the examiner and pass off your sticker, it is important to wash your hands, introduce yourself to the patient, and be aware that you may be required to drape the patient. For your benefit and for the requirement of the exam, it is important to explain what you are doing and what you are seeing. I am looking for signs of. I am going to perform a special test for. I am going to perform a McBurney's test. I'm going to perform an empty can test, etc. I am feeling for swelling, masses, tenderness, etc. On inspection, I see that the patient is comfortable at rest, short of breath, in distress. When you enter a station, look for clues. If you're required to assess JVP, the tools will be provided in the room. If you're required to drape, sheets for draping will be in view. If you're required to perform a special test, perform measurements, all of these items will be provided. In a station, you are allowed and encouraged to request additional tests. If you're performing an abdominal exam, you may want to request a genital urinary exam as well as a rectal exam. If you are in an obstetric station, you may be required to request a vaginal exam. It is important to state out loud that you would like to perform these exams. For the context of this exam, you will not actually perform them, but requests of the exam will be noted. In some exam situations, the results of the exam will be read to you by the examiner. For example, I would like to perform a rectal exam. And the examiner will say, rectal exam reveals blood in the introitus. I would like to perform a full set of vitals. In the interest of time, you will not be able to perform them, but the examiner may be able to read to you the vitals. At the end of an 8-minute station, you may be asked by the examiner a series of questions. Diagnosis, management, or an ethical question. This will be indicated on the instructions that are both on the door and inside the exam room. If you get lost in the exam, the examiner may prompt you to reread the instructions. If you are lost and the examiner does not prompt you, you can always state, "I'm going to take a minute and collect my thoughts," and then defer to the instructions. This is okay. This happens. It is a stressful situation, and the examiners will not penalize you for this. Hopefully this has been a good introduction to the Nac Osce, and hopefully we can continue to help you prepare for your exam. Please subscribe to our channel for future videos.